The International Classification of Diseases 11th revision, ICD-11, focuses on the impairment of self and interpersonal personality functioning, which may be classified according to degree of severity, personality difficulty, mild, moderate, and severe personality disorder. Unlike the polythetic ICD-10 criteria for personality disorders, for example, 5 out of 9 criteria, the ICD-11 diagnostic requirements for personality disorders base the diagnosis on a global evaluation of personality functioning. 10 different types of categorical personality disorder diagnoses no longer exist in the ICD-11 classification. The ICD-11 classification eradicates the excessive comorbidity characterizing the different ICD-10 personality disorder categories. Differential diagnosis of personality disorder. Boundary with personality difficulty. Individuals with pronounced personality characteristics that do not rise to the level of severity to merit a diagnosis of personality disorder may be considered to have personality difficulty if they affect treatment or health services. In contrast to personality disorder, personality difficulty is manifested only intermittently, for example, during times of stress, or at low intensity. 2. Boundary with persistent mental disorders. A number of persistent and enduring mental disorders, for example, autism spectrum disorder, schizotypal disorder, dysmorphic disorder, cyclothymic disorder, separation anxiety disorder, obsessive-compulsive disorder, complex post-traumatic stress disorder, dissociative identity disorder are characterized by enduring disturbances in cognition, emotional experience, and behavior that are maladaptive, manifest across a range of personal and social situations, and that are associated with significant impairment in problems in functioning of aspects of the self, and/or interpersonal dysfunction. Accordingly, individuals with these disorders may also meet the diagnostic requirements for personality disorder. Generally, individuals with such disorders should not be given an additional diagnosis of personality disorder unless additional personality features are present that contribute to significant problems in functioning of aspects of the self or interpersonal functioning. However, even in the absence of these additional features, there may be specific situations in which an additional diagnosis of personality disorder is warranted, for example, entry into clinically indicated forms of treatment that are connected to a personality disorder diagnosis. 3. Boundary with conduct dissocial disorder with limited prosocial emotions. Conduct dissocial disorder is characterized by a recurrent pattern of behavior in which the basic rights of others or major age-appropriate social or cultural norms, rules, or laws are violated. Conduct dissocial disorder with limited prosocial emotions is further characterized by limited or absent empathy or sensitivity to others' feelings and limited or absent remorse, shame, or guilt. Conduct dissocial disorder with limited prosocial emotions has features in common with personality disorder with dissociality, which is characterized by disregard for the rights and feelings of other, self-centeredness, and lack of empathy. Conduct dissocial disorder may be diagnosed among pre-adolescent children and based on shorter duration of symptoms than personality disorder. Among individuals with conduct dissocial disorder, an additional diagnosis of personality disorder is warranted only if there are personality features in addition to dissociality that contribute to significant impairments in functioning of aspects of the self or problems in interpersonal functioning. 4. Boundary with secondary personality change. Secondary personality change is a persistent personality disturbance that represents a change from the individual's previous characteristic personality pattern that is judged to be a direct pathophysiological consequence of a medical condition. Personality disorder is not diagnosed if the symptoms are due to another medical condition. 5. Boundary with disorders due to substance use. Disorders due to substance use often have pervasive effects on functioning of the self and interpersonal functioning. For example, they may exhibit problems with self-direction, self-esteem, difficulties and conflicts in relationship, dissocial behavior related to obtaining or using drugs, and a wide range of other features that are commonly seen in individuals with personality disorder. If the personality disturbance is entirely accounted for by a disorder due to substance use, a diagnosis of personality disorder should not be given. If the personality disturbance is not entirely accounted for by the disorder due to substance use, if the personality disturbance preceded the onset of substance use, or if there are features of a personality disorder that are not accounted for by substance use, perfectionism, an additional diagnosis of personality disorder may be assigned. Severity of personality disorder: mild personality disorder, moderate personality disorder, severe personality disorder. 6 D10.0 Mild Personality Disorder. All general diagnostic requirements for personality disorder are met. 1. Disturbances affect some areas of functioning of the self but not others, or affect all areas but are of mild severity, and may not be apparent in some contexts. 2. There are problems in many interpersonal relationships or in performance of expected occupational and social roles, but some relationships are maintained and/or some roles fulfilled. 3. Specific manifestations of personality disturbances are generally of mild severity. Mild personality disorder is typically not associated with substantial harm to self or others. 5. Mild personality disorder may be associated with substantial distress or with impairment in functioning that is either limited to circumscribed areas, for example, romantic relationships, employment, or present in more areas but of milder severity. Examples of specific personality disturbances in mild personality disorder. 1. The individual's sense of self may be somewhat contradictory and inconsistent with how others view them. 2. The individual has difficulty recovering from injuries to self-esteem. 3. The individual's ability to set appropriate goals and to work towards them is compromised. The individual has difficulty handling even minor setbacks. 4. The individual may have conflicts with supervisors and co-workers, but is generally able to sustain employment. 5. The individual's limitations in the ability to understand and appreciate others' perspectives create difficulties in developing close and mutually satisfying relationships. 6. There may be estrangement in some relationships, but relationships are more commonly characterized by intermittent or frequent, minor conflicts that are not so severe that they cause serious and long-standing disruption. 7. Alternatively, relationships may be characterized by dependence and avoidance of conflict by giving in to others, even at some cost to themselves. 8. Under stress, there may be some distortions in the individual's situational and interpersonal appraisals, but reality testing typically remains intact. 6 D10.1 Moderate Personality Disorder. All general diagnostic requirements for personality disorder are met. 1. Disturbances affect multiple areas of functioning of the self and are of moderate severity. 2. There are marked problems in most interpersonal relationships and the performance of most expected social and occupational roles is compromised to some degree. 3. Relationships are likely to be characterized by conflict, avoidance, withdrawal, or extreme dependency, for example, few friendships maintained, persistent conflict in work relationships and consequent occupational problems, romantic relationships characterized by serious disruption or inappropriate submissiveness. 4. Specific manifestations of personality disturbance are generally of moderate severity. 5. Moderate personality disorder is sometimes associated with harm to self or others. 6. Moderate personality disorder is associated with marked impairment of functioning, although functioning in circumscribed areas may be maintained. Examples of specific personality disturbances in moderate personality disorder. 1. The individual's sense of self may become incoherent in times of crisis. 2. The individual has considerable difficulty maintaining positive self-esteem or, alternatively, has an unrealistically positive self-view that is not modified by evidence to the contrary. 3. The individual exhibits poor emotion regulation in the face of setbacks, often becoming highly upset and giving up easily. 3. Alternatively, the individual may persist unreasonably in pursuit of goals that have no chance of success. 4. The individual may exhibit little genuine interest in or efforts toward sustained employment. 5. Major limitations in the ability to understand and appreciate others' perspectives hinder developing close and mutually satisfying relationships. There are persistent problems in those relationships that do exist. They may be characterized by frequent, serious, and volatile conflict, or be significantly unbalanced. For example, the individual is highly dominant or highly submissive. 7. Under stress there are marked distortions in the individual's situational and interpersonal appraisals. 8. There may be mild dissociative states or psychotic-like beliefs or perceptions, for example, paranoid ideas. Thanks for watching. Please like and subscribe.